Hello and welcome to Male Aesthetics, Foundations for Safe and Masculine Toxin Treatments. Male botulinum toxin treatment is frequently oversimplified. It's often taught as female toxin with higher units, and that's where the problem begins. Male facial structure, muscle dynamics, brow position, and aesthetic ideals are fundamentally different between males and females. In this session, we're going to build a structured clinical framework that allows you to treat male patients safely, confidently, and without feminizing their features. The objective is not transformation, the objective is preservation with refinement. Before we go further, I want to briefly introduce myself and explain why this topic matters to me. My name is Dr. Kieran Lord. My background is in obstetrics and gynecology within the NHS, where anatomy, structural understanding, and surgical provision are central to everything we do. Alongside this, I work as a regenerative aesthetics doctor focused on evidence-based and structurally appropriate treatment approaches. I'm also clinical assistant professor of medical education at one of the UK's top medical schools. My approach to aesthetics is academic and framework driven. I don't teach trends, I teach principles. Over time, I began seeing more male clients presenting at the clinic, and what became clear was that many practitioners were applying female toxin protocols to male faces. The outcomes were inconsistent, sometimes feminizing, sometimes structurally inappropriate. This course exists to close that gap. My aim today is not just to teach you where to inject, but to teach you how to think about injecting. By the end of today's session, you should be able to confidently explain the structural differences between male and female upper faces. You will understand how to assess and preserve masculine brow position. You'll develop safe and effective dosing strategies that follow anatomy rather than assumption. You'll be able to perform male upper face toxin with intention. And importantly, you'll understand how to prevent and manage male-specific complications. Ultimately, you'll be able to deliver results that are natural, structurally appropriate, and subtle. Male aesthetics is one of the fastest growing areas in our industry. Social acceptance is increasing, preventative treatment is becoming normalized, and men are increasingly open to subtle aesthetic optimization. However, traditional toxin training has historically been female dominated in its approach. This creates a clinical gap. When male patients are treated incorrectly, dissatisfaction tends to be higher. The changes are more noticeable, and subtle errors are magnified because masculine structure is easily altered. This is why structured training in male toxin is essential. Now, the core difference. Male toxin doesn't simply equal female toxin with more units. This is the most important conceptual slide of this entire course. So remember, male toxin isn't female toxin with more units. The anatomy is different, the brow position is different, the aesthetic ideal is different. If you simply increase dose without adjusting strategy, you risk altering identity rather than refining expression. We treat structure first, and then we think about lines second. Male facial anatomy differs structurally. The supraorbital ridge is typically more prominent, the brow sits lower, the contour is flatter, the dermis is thicker, and muscle bulk is stronger. These differences influence how toxin behaves, how it diffuses, and how results are perceived. We are not just weakening muscles. Remember, we're modifying dynamic structures. Let's first look at the male brow position. The male brow usually sits at or slightly below the supraorbital rim. It's flatter and heavier laterally with minimal arch. In contrast, the female brow is typically higher, more curved, and laterally elevated. If you introduce arching into a male brow, you feminize the face. The goal in male toxin is softening without elevation and feminization. So what about the masculine aesthetic goals? Male patients rarely request elevation of the eyebrows. They often say that they look tired, they look angry, and they look stressed. They want to look more approachable and refreshed, but they don't want to look treated. They don't want to know they don't want anyone to know that they've had anything done. So subtlety is the objective when we're treating males with aesthetic treatments, particularly with Botox. If someone comments on their toxin, you've likely done too much, and that will prevent the client from coming back to you. So what can go wrong with male toxin? The most common mistakes in male toxin are overlifting the lateral brow and over-treating the frontalis on the first session, which can result in spot brows or arched brows or very heavy brows. Another frequent issue is undertreating the very strong glabella, leaving partial contraction and an incomplete result. This can leave a tired, heavy, and almost angry appearance. Ignoring baseline brow heaviness can lead to a fatigued appearance after treatment, and all of these complications are preventable with structured assessment and proper training. Now let's look at the muscle strength. Men typically have stronger corrugators and stronger frontalis contraction. There is often greater lateral pull and wider treatment zones, and this explains why dosing may be higher. But remember, dose follows anatomy, not gender stereotypes. It's also worth noting that although we need higher doses, if we overtreat a male face, the result can be frozen, which is much less forgiving with males. And we shouldn't underestimate the psychological considerations, not just in male aesthetics, but in anybody's aesthetics. Male patients, however, do often present later in the aging process. They may feel hesitant or self-conscious about treatment or what other people will say about them having treatment. They really do fear looking done or looking feminine. So you've always got to consider this when treating males. Less is often more, and you can always add at a 2-week review. You can't take it away. When carrying out your consultation, you must address these concerns directly. Ask them what they are looking for. Ask them if they have any concerns, anything they really want to avoid. Warn them that there are these risks of being overdone, and explain, like I do, actually, following your first treatment, many people will come back for a review. With female clients, I tend to see a lot less back after the first review, but with men, I'm always cautious. If anything, I slightly undertreat, and therefore it's more likely that they come back for a 2-week review with addition of further units. So explain this to them and make sure your consultant addresses any concerns that they may have. Now, male toxin requires a deliberate clinical framework. You must assess anatomy, develop a brow preservation strategy, evaluate muscle strength, and adopt a conservative first treatment approach. As I mentioned on a previous slide, less is often more, and you can always review at a 2-week appointment. If you add further units, keep a record, and in future, start with this higher dose. But first time round, just start with a low dose and move up slowly. Remember, review and refinement is part of good practice. It's not a failure if you have to stage the treatment. Make sure you explain this to clients. The reason I'm going to do this is I'd much rather you come back in 2 weeks and me add a little bit more toxin than you come back in 2 weeks and say, I'm completely frozen, I don't like it, everyone can tell I've had something done and my eyebrows look heavy, because I can't take it away. The client or the patient will much rather do that and will appreciate your honesty. Now, let's look at male upper face anatomy. The muscles here are the same as they are with female anatomy. So the frontalis muscle, which is the elevator, this elevates the eyebrows. The corrugator and procerus together form the glabella complex, and these cause the frown or the Eleven's lines. And the orbicularis oculi is the circular muscle around the eyes that constricts and is responsible for crow's feet or smile lines. Now, it's important to remember when carrying out any assessment, not just male aesthetics, that the frontalis muscle elevates. Anybody who tells you that they can create a brow lift by injecting the frontalis muscle doesn't understand the basic anatomy and physiology of the muscle. The frontalis muscle elevates the eyebrows. The glabellar complex drops or depresses the medial aspect of the eyebrows, and the orbicularis oculi, when contracts, depresses the lateral aspect of the eyebrow. So, when thinking about treatment in male or female clients, think about their aesthetic goal. Is their primary concern that they look tired and they've got heavy eyebrows? If so, discuss the option of not treating the forehead, not treating the frontalis. This will mean that the frontalis muscle is still active. It elevates the eyebrows and lifts the brows and gives them a much more awake and less tired look. You will treat the corrugator procerus and the orbicularis oculi. These are depressors, and you want to treat these to stop them from pulling down the brows. And if you do this, if you take this approach, just explain to your clients that they will still have forehead lines. They will still have horizontal forehead lines, but it's a good trade-off to give them that elevation. And often for men, it's actually quite a good result because nobody will be able to tell they've had any treatments done. If, however, their main concern is that they have horizontal forehead lines, then you do have to treat the forehead. We'll come on to dosing shortly, but treat it gently, come back for a review, and you want to maintain movement and expression. Let's look at the considerations for the frontalis muscle first. So with males, the frontalis muscle has a larger surface area. It often extends more laterally and more superiorly into the hairline. So it's worth carrying out a proper assessment and actually manually palpating the muscle when the patient's raising their eyebrows, so you can really map out the borders of that muscle. You will often find with men, if you treat where you would treat for a female forehead, they will come back with very high horizontal lines into the hairline. This is because that muscle is inserted higher up. If this happens, you can correct by injecting there, but you can prevent it altogether just by taking your injection points slightly higher in the first place. As we said, this frontalis muscle is responsible for the elevation of the eyebrows, and so overtreatment can result in heaviness. So yes, this forehead muscle may need stronger doses, but by overdosing it, you get the heaviness. So it is a balance. The glabellar complex is responsible for the frown or the 11s. These are often very thick muscles in both men and women, but more so in men. They have a strong medial pull, and it does require adequate dosing. And we'll look at how we increase the doses in the corrugator shortly. The orbicularis oculi muscle is the muscle around the eyes, responsible for the crow's feet. These have strong lateral fibers. Often men have wider crow's feet spread, and there's a risk of excessive lateral lift if it's imbalanced. So if we overtreat the orbicularis oculi, we can get lateral eyebrow elevation, which can look a bit odd. So take it slowly, and again, explain to males, the aim here is to reduce the lines, not get rid of them completely. And yes, just keep your injections safe and a safe dose, and you can always add more 2 weeks later. So we covered this before, but remember, men often fear looking done. The last thing they want is a friend at work, a friend in the gym, a friend at the pub to say, oh, you look different. They fear feminization. They often present later, so they've got more significant aging, and they do want subtle improvement. And it's all about the consultation with male aesthetics. So let's come on to assessment. How do we assess these patients? So let's look at your patient first. Look at the brow position at rest. Is it in the right position? Is it elevated at rest? Is it depressed at rest? If you've already got a heavy brow, you don't want to over-treat the forehead or treat the forehead at all, the frontalis, because this could make things a lot worse. Brow position on animation. When they speak, when they raise their eyebrows, when they're surprised, when they smile, what happens? Look at the forehead height and remember, think about the insertion of that muscle and how high it is into the forehead. Hair recession, that makes a big difference. It can often be difficult to work out where that muscle is if you're going off your usual landmarks, if someone's bald or has a receding hairline. So think about that and palpate the muscle. Remember, the muscle strength is going to be a lot stronger. And keep an eye out for eyelid hooding. Somebody with eyelid hooding, you have to be very careful when treating the frontalis. Dynamic assessment asks the patient to frown maximally. So give me a frown, see how strong that muscle is. Raise your eyebrows fully. Is there any asymmetry? And squint tightly and feel the muscle when they're squinting. You want to comment on strength and symmetry. Compensatory movement. Is there any movement in other muscles to compensate for bits and pieces that aren't quite right there? And lateral dominance. Look at how the lateral part of the frontalis muscle is working. Is that the dominant area of the muscle? Now, dosing strategy. Men typically require, this is where it's difficult, men typically require 20 to 50% higher doses than women. And that's quite a large range if you think about it. The issue here is not only do they require higher doses, if you give too high a dose, this can result in a poor aesthetic outcome. They can look overdone and fake, and it doesn't look good on anybody, but particularly on a male face, it's less forgiving. The other problem you have here is with higher doses comes higher risk of things like travel and spread to other muscle groups, particularly looking at the glabella. If we overdo the glabella complex, there's an increased risk of Botox traveling and causing an eyelid ptosis. So we need to be very careful, which again is why it may be worth bringing the client back for a second treatment rather than hitting them with a huge dose to start with. And whilst I say men typically require 20 to 50% higher dose, dose follows anatomy, not gender alone. So yes, while it's true as a guide, you may find that some of your clients do not require much more than women at all. And some women who come to my clinic actually are the ones who have the highest dose of toxin out of anybody. So it's a good guide, but it's not a hard rule. Here's a rough guide, but you can work this out yourselves. And I'm going to add something later on in the course below where you can do this conversion, because I'm aware that some of you on here will be using Botox, some will be using Bocouture, some using Azalor, Relfydess, Illusions, etc. You can work it out yourself. If you're using 10 units in each of the areas of the glabella, for a male, you may want to use 12 to 15 units in the glabella. It really depends what toxin you're using, but as I said, I will include a slide, a table in this course. Now, male glabella injection points. Key principles here, deeper injections often required. I think this is more so in the case of any glabella injection. The glabella injection is the glabella is a big muscle, it's a chunky muscle, you can feel it. You need to do a deep injection. There are two ways of treating male frown. I prefer option A to option B, but option B is there for somebody who's got a very, very strong frown. You need to provide more toxin. Remember I said earlier in the presentation, the risk here is if we over-inject the glabella, there's a risk of it traveling into the muscle that controls the eyelid and therefore creating an eyelid ptosis. So by spreading the injections out along the glabellar complex with more injections, you potentially can minimize the risk. However, this, like I say, is not my favorite. Deep injections in the procerus, deep injections in the medial aspect of each corrugator, and slightly less deep injections in the lateral aspect of the corrugator to avoid inadvertently hitting the frontalis and causing an eyebrow droop. Now, I would aim for these medial 3 injection points I increase the dose to 50% of what I would in a female face. So if I'm using 10 units, I will use 15 units in each of these 3 zones. In the more lateral aspect of the corrugator, I stick to my usual 10 units. So I don't increase the lateral aspect at all for male toxin. When it comes to male foreheads, we often want to inject higher than in females. Remember that frontalis muscle inserts higher up in the forehead, often very much in the hairline. So palpate the muscle, draw out the borders, and inject high. Worst case scenario, you inject high, patient comes back 2 weeks later with movement in the middle part of the forehead. That's fine. So inject high. First avoid aggressive lateral lift. So make sure you are treating right out to the edges. The frontalis muscle is not only higher on men, but wider. So go right out to the edge of the frontalis. And treat conservatively at first. If we overdo the forehead, this is the giveaway. This is the one that shows everyone that they've had some work done. So slightly underdose and review in 2 weeks. The blue dots on this illustration show my preferred injection points. The 2 red dots are optional ones instead of that medial blue dot, which some of you may have seen before. I don't increase the dose for any of these forehead injections in men, but I do increase the number of injections that I use. So this is more injections than I would use for a female. And you can see that it kind of gives a bit more of a flattening of the brows. So I would use the same dose, just more injections. The reason I don't like the 2 medial red injection points is that this can create some medial forehead heaviness, and it can cause the eyebrows, the glabella complex, to look a bit heavy because you haven't got that medial support. That's why I do a single injection in the middle of the forehead, which is where that blue dot is, and I don't do the red ones. But try it, see what works for you. You may prefer different injection points, but the key here, do not increase the amount of toxin per injection, simply increase the number of injection sites. And crow's feet works very similar to how it does in female treatment. You want to inject the orbicularis oculi. You want to avoid the inferior spread, so don't inject too low down because it can affect the smile. And the way I would suggest you do this is injecting 3 points. The most superior point, I would increase your dose by anywhere between 20 and 50%. The middle point, I would increase again by 20 to 50%. And the lower point, I wouldn't increase at all compared to what you normally do. I tend to always put a half dose in the lower point of the orbicularis oculi, just because I don't want to risk it spreading into muscles that control the smile. Let's look at some risks, okay, and then we'll look at some complications and how to avoid them. What are male-specific risks? Well, brow heaviness. This is a risk for anyone, but for men, particularly, they've got a strong corrugator. Often the eyebrows sit heavier anyway, so that's an even more noticeable risk for men. Lateral over-elevation, so the Spock brow, basically. The lateral aspect of the eyebrows can be overly elevated, and we want to avoid this. This is really not something that a male wants, and they will be on the phone to you coming back for correction. Eyelid ptosis, this is not specific to men, it happens to anybody, but we are using higher doses of toxin in men, therefore the risk of migration and the risk of complications is higher. Asymmetry, again, not specific to men, but another reason to not use too higher doses. We want to go slow so we don't create any asymmetry, and we can always add more. And then incomplete glabella softening is a risk for anybody, but for men particularly because they often need a higher dose. The glabella can be a lot stronger in men, so if we don't use the correct amount of toxin, it can result in incomplete glabella softening, which can result in a heavy frown. Men will come back and say, I look tired, I look angry, or even, I've got this headache. And the headache isn't a typical headache. It's a sort of a dull ache they describe, or like a brain freeze type pain. And it's because of constant contraction of that frown glabella complex due to the unopposed action of the muscle because of the frontalis not working anymore. So if the frontalis isn't working, that's not pulling your eyebrows up, but what is working is your glabella complex is pulling down, and it's a constant contraction. And because of that, it'd be like if you sat there now and constantly contracted your bicep. You'd last a few minutes before the pain would be so much that you'd relax and you'd have to stop. And that's what's happening in your forehead when we've not properly treated the glabella. Now let's look at some of the complications in a bit more detail. Brow heaviness. This is caused by either over-weakening of the frontalis. So the frontalis muscle has been over-weakened and there's no muscle tone left, so it can't elevate the brows. Strong depressors, which have been left untreated, either on purpose. If you haven't treated the glabella complex, then that'll be the reason for it. You should always treat the glabella complex when you're treating the frontalis. Or if someone's already got a low baseline brow, which is why your assessment's so important. If someone's already got low baseline brows, so they're already quite low on the head, on the face, you probably don't want to treat the frontalis. You probably want to leave the frontalis alone, elevate the eyebrows with the frontalis, treat the corrugator, the procerus, and the orbicularis oculi, and see what result they get. And in my clinic, I would say to somebody who wanted the frontalis done but already had heavy brows, why don't we not do your frontalis, have your frown and your crow's feet treated, come back in 2 weeks and let me see you. And if you still want it done, I'll do it then. Because a lot of people come back and go, I look great, I feel fresh, everyone's saying how good I look, how well rested I look, and they won't want the forehead doing. The way we prevent this brow heaviness is to take a conservative approach to dosing, particularly in the frontalis muscle. We don't want to overdo it, and take a staged approach. Bring them back 2 weeks later and add more. Now, the spot brow. This is due to undertreated lateral frontalis muscles. Remember, the frontalis muscle in men extends often more lateral than it does in women. And if we undertreat this area, you can get a spot brow. This gives the game away in everyone, not just men, that they've had toxin. The way we correct this is by dropping micro doses of toxin about 2 centimeters above the eyebrow into that lateral muscle fiber. And the way we kind of prevent it in the first place is just to make sure we are taking our injections initially that little bit more lateral than we do in females. When you first see a patient who comes into your clinic, so the first time you finish this course and you go and treat a patient in your clinic, how are you going to approach a male patient differently? So first, treat your glabella confidently. Your glabella is a really forgiving area. If you overtreat the forehead, you get heaviness. If you overtreat the glabella, you're not really going to get much in the way of heaviness. You're just going to get no expression, which isn't great, but it's a bit more forgiving than doing the forehead. That being said, just be mindful of toxin spread, and the more toxin we use, the higher the concentration, the higher the volume of product, the more chance there is of spread. But still, consider treating the glabella confidently. Go conservatively in the forehead. When treating the frontalis muscle, less is often more. Don't increase your dose, increase your injection points, and bring them back 2 weeks later. It's much easier to add toxin. You can't take it away. Expect a review at 2 weeks. Review the client or patient. If they need further toxin, add more. Document the dose you've used, the injection points you've used, and then in future, just start with that. For the first appointment, expect them to come back. And employ this preservation strategy. Preserve structure and function of the muscles of the face. You want to soften hyperactivity, but maintain masculinity. When it comes to your consent and communication, this is really important regardless of the gender of your patient. But for males particularly, discuss subtlety, discuss movement preservation, explain to them that, frozen doesn't look good, particularly in anybody, but particularly not men. If they want a subtle result and no one to know, you want to keep movement. Consider whether or not they want their frontalis muscle treated. Most people come in and they just know 3 areas because that's all we tell them about. But say, does your frontalis muscle bother you? Does your forehead lines bother you? If actually no, don't treat it. Leave it alone. Gives them good expression keeps their eyebrows elevated, so you reduce this risk of heaviness. And it means that no one's going to be able to tell they've had anything done. And think about a staged refinement. If someone's never had treatment before, remember, males often present a little bit older, a little bit further along the aging process. If you jump in and do 3 areas of toxin and do high doses and completely freeze them, it's a bit of a shock to them, and the friends and family may notice. So staged refinement. Well, what's bothering you most? Is it just your frown area because you always look angry? Okay, let's just treat your frown. Let's soften that. Next time you come in, let's add a little bit more. Maybe we do your frontalis. Maybe we do your auricularis oculi. Do it in stages. Now, we've got a couple of cases before we wrap things up. The first case, the patient presents to you and they have got a strong glabella. They've got a low brow already. That's naturally sitting on or below the orbital rim. And they already appear to have heavy upper lids. What would you counsel them? What areas would you think about treating? Have a little think about this. Pause this video. Think about the client coming into you in your clinic. What would you do? Okay, hopefully by now you've had some time to think about that case. If someone's got a strong glabella, you want to treat the glabella. If they've already got a low brow and a heavy upper lid, hopefully you can see this patient by treating their forehead, by treating the frontalis, chances are you're going to make that worse. They're going to look more tired. I would suggest in this case, counsel them on that. Counsel them on, are you bothered about horizontal forehead lines? If you're not, let's not treat it, because you're going to get a much better aesthetic outcome if we don't treat it. Instead, we'll treat your glabella, we'll treat your orbicularis oculi, but we'll leave your frontalis muscle well alone so that that can work and elevate the brows. What about this? Case 2. Patient comes in, he's a male patient with a very high hairline, receding hairline. He's got strong frontalis, but he's got minimal glabella movement. What's your treatment strategy going to be? Have a think about it, pause the video, and come back when you're ready. Right, hopefully you've had time to think about this one. This one's a little bit more tricky. Important thing to point out here is this patient's got a high hairline. Chances are that frontalis muscle is going to be inserted pretty highly. So first things first, carry out a full assessment. Palpate that muscle, mark out the borders. So if you are going to treat it, you know where you're injecting. The patient has a strong frontalis. If you've said treat the frontalis, well, maybe, but we need to ask the patient, what are they bothered about? What are their concerns? Are they bothered about the horizontal lines? It may not be. Are they more concerned about people being able to tell they've had it done? Because if you've already got a strong frontalis, it's probably quite noticeable that you've got horizontal forehead lines. If we overtreat that area, people are going to be able to tell. So what are they concerned about? Are they bothered about people knowing? Do the horizontal forehead lines bother them? If they are bothered by them, yes, we'll treat them. Actually, they may not be bothered. They may say, you know what, my main concern is when I'm on holiday and I'm squinting in the sun, I get lines where my crow's feet are, so I'm only bothered about crow's feet. Fine, just treat that. Okay? So this highlights the importance of personalized care. No matter who you see in your clinic, male, female, etc., carry out a thorough assessment, take a good history, counsel them on outcomes, really get to understand your patient, really understand what bothers them and what they are hoping to achieve. And now the key take-home messages. Male anatomy differs structurally from female anatomy. Brow preservation is critical in men. The brows are often lower to start with and are flatter. We don't want to elevate them too much. We don't want to arch them. The dose must follow assessment. The dose will be higher in males and females, almost always, between 20 and 50% higher. But as we've seen, that doesn't just mean injecting 50% more in every single injection. You've got to adapt your approach, change your injection technique, and also adapt the amount of toxin you're using. Always undertreat and bring back on your first treatment rather than overtreat and cause artificial looks. Overlifting of the eyebrows can feminize the face, so we want to avoid that where possible. And with male aesthetics, subtlety is the key. I believe this is the case in both male and female aesthetics. However, more so in males, you want the results to be subtle. The last thing a male wants often is for someone to say, "You've had Botox." So bear that in mind. Undertreat, invite them back for a 2-week review, and the clients will thank you for it. Now, thank you very much for listening to this presentation. This forms just a small part of the course. Feel free to take it at your own pace, have a look at the written information, watch the videos. We have some practical videos showing you how to mark up for Toxin, how to draw up Toxin, how to administer Toxin to the male client. These are yours to keep and watch back time and time again. So please make the most of it. Thank you very much, and I hope you enjoy the rest of the course.